manipulation for a drug. And I don't think that's going to produce the results if you set those as the goals of just eliminating the drug. And I would like to just congratulate you guys on taking one step at a time. Danny's very frustrated that every journey begins with one step, and you guys have obviously taken a lot of steps. And I didn't mean to get on a soapbox. But
no, thank
that
you.
was the reason I was here. Forward autism and cerebral palsy. I'll do it. Thank you.
Yeah, I'd like to say something about that to Ken. That's a great point. Is we don't treat just one area of the body. We look at the person as a whole, and to see their whole system, functioning. And in the case of autism, seeing them where they're more connected in their body. Because when they're more connected in their body, they're more connected in their health, more connected in their life. So really seeing them as a whole. So I really appreciate that, Ken.
Yeah, I think that's a good point. I think what your question and your point is a really good one, that it's not just adding more tools to the toolbox. So it's not just, we can put needles in now. We can do drugs, we can do surgery now, and we can put needles in. That's great. But it's like a different way of working, and a way of working together where we're seeing the whole person, body, mind, and spirit, however you want to call it, where we're seeing the connection of that person to their family, to the community at large, to the society. And then where we're all communicating about our needles and our drugs and our surgeries, and making sure that we're applying the right tool at the right time in the context of that bigger picture. So that's kind of, that's, I think, where I hope we're taking integrative medicine. And I think it's got a chance of getting there, I hope so, but it's definitely, Danny's probably got a little while to be frustrated. You gotta just keep working at it. We need you,
Well, I think that every week in the chronic pain program at Children's Hospital, they have an integrative meeting, or the goal is every week to have this meeting, where the acupuncturists come in with the treating physician, with the nurse practitioner, and the physical therapist, and the biofeedback, and cognitive behavioral therapists, and they all meet and they all do an assessment on the same child or family situation, and then they brainstorm about possible approaches to this child's meet this child's needs, and they look at the child not just their physical body, but also the social setting that the child comes from. Is this person's pain or this person's diet the biggest problem, or is the biggest problem the fact that they don't have a place to live or enough money to get on the bus to get treatment? And that really opened my eyes. I had been working, in a side-by-side with a physician, but not necessarily having that same team approach. And so after experiencing that, I went back to my office, and we implemented a team approach. So we would have a weekly meeting to discuss the new patients. And I think that's, maybe that communication is if not the pinnacle, at least the starting point of creating integrative medicine. And that's the team approach to the individual.
I hate to call somebody out, but I don't understand this question. Please say more about the environment as a feedback mechanism.
Yeah, I thought I heard you say something about that. You were talking about the patient creating. You were saying something about the relationship between the patient and the environment. I thought you said something about the environment then becoming like a feedback mechanism, sort of like concept of feng shui, so to speak.
I can't think of what I was really talking about there.
It was in reference to your visit to China, and then the liver conversation, and how that proceeded into the ear ache, and how that was treated as a more of a hole in the environment and manifesting the problem or the solution.
Okay.
He just wants more of a definition of environment in that regard.
Well, one of the things I've come to think in my mind is that not all of, I try and talk your language, not all of it is like the evil stuff on the outside. Some of it is your own body becoming unable to combat effects, whether that be because of poor nutrition, the environment, maybe there's smoke in the home, allergens in the home, so your environment and how you take care of your body either disallows or enables pathogens to come in. And so I think from particularly Chinese medicine perspective, the thought in a lot of traditional medicine, people are coming around to the fact that we really need to treat the person rather than some specific disease. And so that's where I think a lot of people are coming into the health movement. And that's a key factor. Now, like in this book that I was reading, there are some things where you have a staph infection or something that just overwhelms the body. But you can certainly put yourself into a better state of mind and better state of health to combat those things. And that has clearly to do with your environment there. I don't know if that answered your question at all, but.
I have a follow-up environmental question. Have you seen green improvements in hospitals as well as in integrative medicine facilities, acupuncturists, businesses? Where do you guys stand as a panel in general with I know my acupuncturist will do acupuncture on me. I don't know if he's recycling the needles, and I don't know if that's sterile to do so. But what businesses and nonprofits are moving towards being more green, and is integrative medicine a green thing for our future and for our environment?
I hope so. Definitely hope so. I can answer part of your question that UCSD, we're starting a Center for Integrative Medicine